get started. My name is Sharon Farrar, and it's a pleasure to be with you guys tonight. And thanks for inviting your family members to join as well. Hopefully you guys can see my PowerPoint. Let's see if you can see it. Hold on. And I can see Connie. Can you say thumbs up if you could see my one simple change? All right, good. That's the beauty of having you guys watching. Okay, well, it was just one simple change that really made a tremendous difference for my health almost 17 years ago. So a lot of what I'm going to share with you tonight is what has happened since, and my learning process. A lot of what got me excited was the intellectual part. I have a couple master's degrees. I love learning. I love education. And those master's degrees taught me nothing about nutrition. And so when I started to learn all this information, I was just on fire because I was like, wow, everybody needs to know this. And so the Juice Plus company is who's presenting this information tonight. And we're part of that. A lot of us, we're part of a community that's like-minded, health conscious, and we're on a mission. We're on a mission to make a difference. Our mission statement is to inspire healthy living. I was looking at the one simple change. To inspire healthy living around the world, and how we're doing that is by helping people make one simple change at a time. And we do that in community meetings and Zoom presentations and our Facebook groups, and as we live life. We really are all about our mission, which is to inspire healthy living. So thank you so much. We really want to touch future generations with better health. And, we want to help everybody take care of their bodies. There's a lot of sickness and disease, but the problem is you've only got one body, so every day, whatever you do, whatever you put in your body, whatever you do to your body, it really makes a difference, and those habits are really what we have to get under control. And it really involves some discipline. It involves some just simple, different changes. Whatever you could do to make those habits easier, but most effective. And so we're going to talk about some of those things that I've learned. I am not a perfect eater at all, but I've learned ways to really offset the things that we might want to eat, that we desire to eat, that we might want to do with some simple changes that are a little better. And so in our country, we are very affluent, but we have all this disease, and a lot of it may have affected your family. Heart disease, cancer, diabetes is on the rise, obesity, lots of medications, and our teens and our children are following suit. And it's really quite scary, and a lot of the diseases that used to be called adult diseases, like adult onset diabetes, they took that name away because now children are getting it, and so they're kind of headed in that same direction, which is very scary. And then a lot of people are going around with 40 pounds of being overweight. And look at what happens if you're just 40 pounds overweight. And in America, that can happen very easily because of our standard American diet. They call it the SAD diet. And because of our lifestyle choices of being in an industrial, an industrial nation where we don't have to move around, like you're saying, Nalani. Nalani walked 5 miles for the last week every day. And so we're not forced to walk anymore, and so we are, gaining weight. And with that, you would maybe expect the heart attack, the diabetes, the high blood pressure with weight gain. But you've also got things like cancer. Who would have thought that adding 40 pounds to yourself increases your chances of cancer by 80%, and all those other things by hundreds of percentage points. So we want to be careful. We want to keep ourselves lean, and we want to look at our lifestyle choices. And so longevity is based a lot on our lifestyle choices, 3/4, in fact. And genetics might predispose us for something, but as it says, in the end, genetics might load the gun, but our lifestyle is what pulls the trigger. So we want to really be careful. And so you can look at those two men and see who's going to have that more active lifestyle. And don't we want to have that vitality and energy as we get older? Well, the striking reality is that most of the food is processed, and we have to be very careful when we go down the aisles. A lot of our whole foods that we're going to talk about that are better for us are in the perimeter of the aisles, or the perimeter of the store. And in the aisles, they have a lot of processed or packaged foods. Well, those foods are meant to last a very long time. And so they are packaged to, have chemicals in them so that they can stay fresh. But that's not necessarily to our advantage. And so unfortunately, we're faced with that every day. And then we need to know that our children are harmed by poor diet more than drugs, alcohol, and tobacco combined. And so experts agree that 75% of diseases are really preventable through nutrition. So what is good nutrition? I learned many years ago that it's really things that grew from the ground, plants. And those don't have a label, and they rot, as you can see with the watermelon, or they sprout, as you can imagine with a potato that might be in your refrigerator. So day one of that watermelon looks great, but not later, right? And you might find things like that in your refrigerator. Well, what about a Happy Meal? You can see that did not rot. So we say if it doesn't rot or sprout, throw it out, okay? Because live beings need live enzymes, and that comes from real food. Well, when you do go down those aisles, it's good to be a nutrition detective. It's better to eat the whole food that you've maybe cooked at home, that maybe is in its whole food package still, like an apple, nuts, seeds, beans, things like that.
Please look at the stage. Your 2020 evening actress, Grammy Award winner, and multi-platinum selling recording artist.
I think it's worth it to meet everybody again. Okay. I'm glad I did. Okay, back to the presentation. Okay, it always happens on different things. Okay, let me see if I can get rid of that big box that I now have on my screen. Okay, so back to where I was. Okay, so when you do go to the shopping center and you do have things to look at, you want to not trust the front cover, okay? That might fool you and look at, say grains and fruits and all that, and it might look good. It might seem like it's a good option, but it might not be. You want to look at the quality of the ingredients on the actual package. So just know that the first ingredient is the biggest. And you want to identify harmful ingredients like MSG, hydrogenated oils, colors and numbers, things that just don't seem natural that you would never put in your own food at home. And then also, just like that, is a long ingredient list. You want to stay away from that. There's a better choice always. My kids, when I was, when I took them to the store, they don't seem to want to go to the store anymore. But when I did take them, they're now 16 and 17, my older ones, I'd say, okay, just go in this one little particular area, grab something and get out of that processed food aisle, because like the cereal or something, I would just let them get, because we have a thing called GreenWise here. Anyway, and then when you do buy processed food, because we need so much fiber every day, you want to look for at least 2 grams of fiber or more, okay, if you do buy a packaged food. And then people are trying to bridge that gap, of what they're supposed to be eating, because they don't eat enough of the real foods. They say, oh, I feel run down, or, oh, I'm not eating right, because we are eating poorly. And so what they try to do is bridge the gap by taking a vitamin. And you can see some of those things that I named that are harmful ingredients are on that vitamin label. And it's on a lot of vitamin labels. And there's a lot of controversy about vitamins, and you can read that online. But this particular one not only has the isolated vitamins that may be harmful, but also a lot of extra ingredients that we really don't need in our diets. In fact, our vitamins are supposed to come from food sources. I was amazed by this. Like I said, I was in graduate school a very long time, but knew nothing about nutrition. And when I heard that vitamins and minerals came from whole foods, I was like, where have I been? How come I never learned this in school? And why didn't anybody tell me why I should be eating fruits and vegetables? That is where your vitamins and minerals come from. I just thought, oh, they come from my grandmother who just used to shove these vitamin C pills down my mouth, And so it was really eye-opening to find out that there's only been actually 13 vitamins that have ever been discovered ever. So if you go on the internet and you say, how many vitamins have ever been identified. That means they're connected to a specific disease. They've been identified, they've been replicated and put into a multivitamin. It's only 13. But yet there's whole stores that are called vitamin stores. And then when they add minerals to a multivitamin, you might get 30. Okay, but I just want you guys to realize that in a whole food, you'll get thousands. You'll get thousands in the red pepper, thousands in the apple, thousands in the tomato. And they've all got different properties, thousands in the blueberries. So all the different colors of all the fruits and vegetables, they all have great things to offer, but they are all in very minute amounts. Like if you look at that picture of the apple and what's in the apple, everything's like 5 milligrams, not 1,500 milligrams, because it's with the synergy of that whole orchestra of what's supposed to be in that apple. And that page, in fact, is just one of 25 of what is in an apple. So every fruit or vegetable, plant, herbs that grew from the ground, they've all got what's called phytonutrients or phytochemicals. So you get your enzymes, your live enzymes if you haven't cooked it. And you also get your phytochemicals, your vitamins and your minerals. And so better than vitamins, if you see on the left, phytochemicals, that's what can prevent cancer. That's what I'm going to share with you. And the truth about antioxidants, we're going to go over that. So the Journal of the American Medical Association said popping vitamin pills may actually increase the risk of death. Americans should get their vitamins from food. And that's not so far from what Thomas Edison said many years ago. The doctor of the future will no longer treat the human frame with drugs, but would rather cure and prevent disease with nutrition. So we really need to look at the foundation of nutrition, which is a lot of fruits and vegetables. You really want to eat these all day long, in all the different colors. Look at that American Cancer Society poster. That's what really got me many years ago to open my eyes, because who wants to get cancer? Nobody wants to get cancer, but nobody really thinks they're gonna get cancer either. And the statistics are real, 1 in 2 and 1 in 3. And so you really do want to do everything you can to prevent cancer and also to reduce the likelihood that it'll grow. So the American Cancer Society poster, they could pick anything to put on that poster. They could say, watch for fast growing or irregular moles, stop smoking, things like that. But look at that, fruits and vegetables. That's how you prevent cancer. So that should make you want to dig out those fruits and vegetables, cut them up on the counter, juice them, whatever you have to do to eat lots and lots of fruits and vegetables. The minimum in our country, which remember our country is not all that healthy, is 7 for kids, 13 for men. Okay. And so women kind of fall in the middle, but that's the minimum. So you really want to eat them all day long, just as many as you can. And so this is an article in Time Magazine saying the news isn't that fruits and vegetables are good for you, it's that they're so good they could save your life. You can see when people are diagnosed with something, they turn to lots of fruits and vegetables, juicing, things like that. Now, why is that? What's happening on the cellular level that fruits and vegetables do for us? Well, they have antioxidants, those vitamins and minerals. They're called antioxidants. And so a normal cell, just from regular metabolism, they are experiencing oxidative stress. And the oxidative stress, what happens with that metabolism is there's a free radical, it's called. And the free radical is like this electron that's going around trying to find a pair, and it hits on the good cell 10,000 oxidative hits a day. And so every day that you're without fruits and vegetables, it is said that it is like standing in front of an X-ray machine. So we don't want that. And we experience those oxidative hits if we don't have enough fruits and vegetables in our body. So that's what's called oxidative stress. We all have it. Some of us have it more than others, depending on our practices of what we're doing with our lifestyle. Even exercising creates more oxidative stress. So you've really got to keep up your antioxidants from fruits and vegetables. So our company has 3 different ways to help bridge that nutritional gap. Okay, so you can see on the right that hamburger, and I'm sure, and French fries, which is what we're looking at like daily, all these different foods that smell so good, look so good, but you might not feel so good afterwards. And so these were available to us. Also, birthday party foods of the 50s, those are now readily available. There's always desserts available. There's always fast foods available, all those things. But in reality, we need to make those other choices. So how can we do that? Well, our company offers 3 different ways that are considered tools to help bridge that nutritional gap. because we want to pick plants. Well, one of the things that we have is called the Tower Garden by Juice Plus. And this is a vertical, as you can see, it grows up and down, doesn't take up a lot of space, doesn't take up like a plot of land that's 10 by 10. And so you can grow easily indoors or outdoors, on your porch, outside in the sun, either way, a lot of plants of your own. And that takes out, the risk of genetic modification, pesticides, herbicides. It also helps you to have vine ripen. It also helps you to have it not rotting in your refrigerator, which is what happens to me. I think I might want cilantro on Monday, but then I come in on Thursday and so I don't know if you guys have that experience, but I do. And so when you have a tower garden or something like that, you could just go out and eat it as you please, as you desire it. And so the tower garden is just a way to have something residential that you're able to have and grow your own. And so there's no dirt. It's hydroponic and aeroponic. So it works with water in the bottom basin with nutrients, and it has a pump so that it goes and waters the roots. It goes all the way up to the top, waters the roots, and comes down on those roots. And then it's aeroponic, meaning air gets to it. It's 15 minutes on with the timer, 15 minutes off. So the aeroponic part actually grows it stronger and faster. And so we're having a lot of fun with our tower gardens. Whoever invited you tonight, you might see pictures of them online, things like that. It's a fun thing for the kids too, and beautiful. Nature is beautiful. And so when you have a garden like that, you're looking out there and you're like, what am I supposed to do with this stuff? Maybe I'll put it in a smoothie, or, oh, I better have a salad today. So that helps inspire you to eat some more fruits, vegetables, and herbs. And then this is fruits, vegetables, and berries in a capsule or a chewable. And this is really smart and easy. And this is something I'm really excited about that's changed my health. This is a way to get 30 different fruits, vegetables, and berries. You can see them all on here, all the different colors, just like that American Cancer Society poster had all those colors. Well, this is a way to get that whole rainbow, the blues and purples. They're known for circulation, heart, helping the brain, things like that. The orchard and garden, it helps with the immune system. It helps with the digestive system, all kinds of different things. We're seeing so many great results. This is my before and after picture. And so hopefully you guys can just see that I'm a lot healthier looking, at least. With my third baby, I knew nothing. And I just did my best. And I was not healthy at all. I was not a healthy eater. But it was after that a friend of mine introduced me to Juice Plus, and that is the fruits and vegetables and berries in a capsule, also chewable form. And so I just started taking that, and I was so glad that I finally had something that was going to help me to really bridge that gap, because we don't have a vitamin deficiency, we have a whole food deficiency. If we're not eating all those fruits and vegetables and berries every day, then that's where the gap is. And so you can see many, many years later, this was 8 years later, the bottom picture, I had a baby at age 40 and I felt healthier than ever. I went into the OBGYN, I'm like, I'm pregnant, and he was like, not thrilled. Okay. And he's handing me these different brochures showing me what could happen because I was what was called advanced age. But I said, listen, buddy, no, I didn't say buddy, but I said, listen, I have made so many simple changes all along the way. And the first one was with Juice Plus, and a couple other ones was with our complete shake, which I'll cover in a little while, and also flaxseed. And I thought, man, I've done so much already that has helped me. And then over time, I've made simple changes. And that's what our whole slogan is, to just make those simple changes and have better health. And so at age 40, I had my baby. I encourage other mommies who are trying to get pregnant. Some people are experiencing infertility, miscarriages, things like that. I like to say I've helped people get pregnant. Some people, have been able to go on Juice Plus, change their outlook, and be able to get pregnant, be able to have a baby at age 40. It's great to feel good at that age too. And now it's even later for me, and so I feel really good where I used to be really, really run down. I used to have a lot of allergies, really drained, things like that. And I definitely am experiencing so much better health and vitality. Here are some of the institutions that have done Juice Plus research. Juice Plus really stands alone in 3 areas. It's a whole food product. It has a food label. It does not have herbicides, pesticides, heavy metals, things like that. And we have a third party validating that. And the thing that really gets me excited the most, though, is the research behind Juice Plus, because that is what my one of my majors was in research. So I knew right away that this was a really solid product, and that I was safe to use it for my second pregnancy. And then you guys saw my third pregnancy at the bottom of that picture. But I was happy to really use it in my pregnancy. And, they're using it at University of Mississippi with pregnant women. They're using it on ovarian cancer patients at University of Texas, MD Anderson. And if they can use it on those fragile people, after going through all the hoops of what they have to do to prove Juice Plus is not just safe, but also effective before they're able to use it on people like that and students at these colleges or people at these medical centers, then it's safer and effective for us also. And so also, if you just look down here, the National Institute of Health is actually paying for one of our Juice Plus studies as well. And so what do they find? The thing that gets me most excited is to slow that aging process. Remember that oxidative stress? So with oxidative stress, you age faster. And you also have more damage, more mutation, but Juice Plus is able to slow that oxidative stress. And within 28 days, it's reduced by 75%. And we've had study after study confirm that. So it really takes away a lot of that oxidative stress. With oxidative stress, you then have some damage to your DNA. It's like making a copy of a copy of a copy on a copy machine, how that doesn't look so good anymore. Well, that's what happens to our DNA. As it replicates, it gets a little bit of damage every single time, every time it makes an X cell. Well, you want that to slow down. And that's what happens with Juice Plus. We've been able to prove in at least 3 studies, I think it was like 20 something to 66%, depending on the study, of less DNA damage. So that's really, really important. And then I loved having a better immune system. I no longer have allergies. I no longer feel run down. I no longer get a cold that then turns into the hacking cough and the antibiotics. My kids don't have to go to the doctor for sickness. So, and I know a lot of kids that do, a lot of kids are on antibiotic after antibiotic. And then the other thing is we've been able to help a lot of people with autoimmune disorders, because that's just the immune system being out of balance. And then another part of that is with inflammation in the body, everything gets out of whack, and that actually promotes disease as well. And then there's some great things like having better skin, having healthier gums, things like that. It's all good. Here is one particular study that we love in the Juice Plus community because it just kind of brings everything together. And it shows the power of more fruits and vegetables. And also, that you can't necessarily take people out of McDonald's, but you can help protect them. And so this was a study that was done using 2 McMuffins and 2 hash browns, and they induced blood vessel constriction. Whenever you have a high-fat meal, you are inducing blood vessel constriction, which your arteries go from being open to being closed 40 to 60%, 4 to 6 hours. And so that's a window of not good opportunity, for something that could happen with the heart. And so they wanted to look at what happens if you take Juice Plus, after you've eaten that high-fat meal. And so what they found, you can see with the purple, if you just look at day 28, after taking the placebo for 28 days, there was really not much of a change at all. With the Orchard and Garden blend, that's the red and the green, there was 62% less blood vessel constriction. That was pretty significant, and that would have landed them in that journal with that significant result. With the Orchard, Garden, and Vineyard blend, when they added the berries and the grape skins that were specifically made for heart and circulation, there was 98% less blood vessel constriction. So we like to say, you may not be able to get the people out of McDonald's, but at least you can help them, to not have that blood vessel constriction. And in fact, the journal itself said it basically eliminated the detrimental effect of the high-fat meal. So it's really, really important information. Like I said, more matters. All the different colors of the rainbow matter, and raw fruits and vegetables matter. And that is what Juice Plus is. I get a lot of questions about, well, can Juice Plus help with this? Can Juice Plus help with that? Look on here, you can just see some of the things that are happening in America that people might ask me about. And so really it comes down to, would better nutrition help that? And better nutrition helps everything. If you look online and you look at any disease, it's better helped with fruits and vegetables, okay? So we don't like to make promises. We've seen a lot. We've seen a lot of great results, but we can't predict what's going to happen with somebody. But either way, they're going to have great results just because they're having great nutrition. And so I just always come back to that, because the foundation of better health is fruits and vegetables. Now, we also have a population study, and also a really good deal for families, which is buy an adult Juice Plus, capsules or chewables, and get a child free. And they are considered the role models so that their children can watch them and see their differences, and they can all get healthy together. So with that, we have 1 million children on Juice Plus, and this is just a sampling of what they found. Definitely less prescription and over-the-counter drugs, less missing days of school because they're not as sick. They're eating more fruits and vegetables. They actually crave more fruits and vegetables because of cellular memory, and they're visiting the doctor less. And also, there's Dr. William Sears and just some of our pregnant buddies, just to reiterate that it's good for anyone, womb to tomb, and a lot of us have had Juice Plus babies. Well, let's look at, we're going to go from micronutrients, which really is the oil in the car, that sometimes we forget, to do that. We don't necessarily forget the gas, which is our cravings. We want the macronutrients, our food every day. And we need those micronutrients, those vitamins, minerals, enzymes that only come from those whole foods. The macronutrients are important also to eat healthier choices. And one really healthy choice that we have from our company, and this is our third way to help bridge that gap. And this is what I've been using for 17 years as well, every day pretty much. Wouldn't want to do without it. And sometimes twice a day is our complete smoothie, and we just make it in the morning. Dr. William Sears recommends that for, everything. For children, he calls it a brainy breakfast. And we've used it a lot, and it just is so good. And it has non-genetically modified plants. It's a way to increase your plants. You really want to increase your plants, decrease your animal as much as you can. That's going to decrease inflammation in your body. That's going to make you healthier. I'm not saying you have to be a vegan or a vegetarian, but you just want to cut down on the amount of animal protein, whether it's from dairy or the actual meat from fish or chicken or beef, any of that. The healthy countries don't eat nearly as much as our country does in that category. So this is a way to get your protein from plants, and with that, you also get your fiber, which in reality, we need about 50 grams every single day for optimal health. And that comes from eating plants, really. You can't find very many packaged foods that have a lot of fiber unless they have a lot of plants in them. And then you also have these extra ingredients that are so good for you: spirulina, from blue-green algae, pumpkin pomegranate powders, ancient grains, broccoli, alfalfa, radish sprouts. And if somebody put all that on a dish, I would not be able to eat it. But in a healthy shape, I love it, love it, love it every single day. And we all have great recipes to help you along with that. And so there's also comments or questions about, how can I transform my body? How can I change my body shape? And I just want to offer some tips that I've seen over the years that have helped, or some things that I've just heard from people who say, I can't lose weight, and the first question, I don't know what popped in your mind, was, do they eat breakfast? And that's what I asked first. Are you eating breakfast? I heard a personal trainer many years ago. He said, if you want the inverted triangle body, you need to eat breakfast in a really good at the beginning of the day, and really you want to jumpstart your metabolism right when you wake up. Right after you wake up, you want to eat right away. Some people have their coffee, then they do this or that, then they finally eat. Well, you're not jumpstarting your metabolism, you're not breaking your fast. So it's really important to eat right away, and to eat a really healthy meal. And then to not be afraid, if you're eating healthy, don't be afraid of eating every 3 to 4 hours. Dr. Sears calls that grazing even. You can eat plant foods all day long. There's a book out there called Eat More, Weigh Less, and it's all based on, if you eat a lot of plants, you're going to get fuller and you're going to not weigh as much. You're going to be leaner. So anyway, a couple of bits of advice with that. And then what we've also found is people who eat late. So what they do instead is they don't eat in the morning, and then they starve, and then they celebrate at night. So they say, oh, I have a hard time with self-control at night. And that's because they've kind of starved themselves all day. So, just some of those are just little tips on helping with the body shape, but we've also got some programs that we can plug you into with Juice Plus. And what we found, eating the 3 blend of the capsules, the fruits, vegetables, and berries, 1 to 2 complete shakes a day is really good, especially if you want more results, you want to have 2 shakes a day. And so what we do is we go from bathroom to blender right away, breaking that fast, then also having one like around 4 o'clock at night, not night, in the afternoon, or 3, just to take that edge off of being so hungry at night that you overeat. And also you don't want to let yourself get so hungry any time of the day, because then it's like past a point of no return. And then healthy snacks, healthy meals throughout the day. And we have some good information on our Facebook groups. And here's just one example of a whole family's transformation. This is Elijah and Dorothy. And I just love their story. Because, it's like stories that we see in our community that are just so wonderful because it changes their quality of life. Dorothy and Elijah, used to have to be together all the time pretty much because Elijah could not finish 5 days of school. He couldn't go to swimming. He couldn't go to Haiti to visit Dorothy's extended relatives she really wanted him to meet. And he was sick a lot. So they were in the doctor's office a lot. And he was taking that shower curtain around the house because he could throw up at any moment, and so he was kind of born that way. And after, 2 months, he just started always throwing up, had croup, pneumonia, asthma, eczema, you name it. He had it. And Dorothy was at a loss, what to do. He wasn't gaining weight. The doctors, they wanted him to gain weight. The school officials are like, he needs to gain weight and he needs to get to school, all these things. And Dorothy was just, at a loss. And so finally somebody introduced Juice Plus to the family, and Elijah just started eating some of the Orchard and Garden Blend gummies, and he got better. And it was amazing. And he started to gain weight, and he no longer needs that shower curtain. And so, he's been able to complete 5 days of school. He's been able to go to Haiti now. He's been able to take swimming lessons. He's not getting sick. He's out of the doctor's office. It's like phenomenal. And, you could get more information on that. I'm sure if you want to know more about Elijah, it's just so cool. But the same time, Dorothy got healthy, and she was no longer in that caretaker role. The caretaker is always the one that kind of neglects themselves. And so finally she was able to pay attention to herself, and she lost 20 pounds, and she was able to take Juice Plus and also our complete shake and do that. And now she's pregnant. So it's really exciting to see that whole family's transformation. I love Maggie's transformation. I never expected Maggie's transformation. All of a sudden I see her on Facebook and she's lifting weights over her head, like these big weights. And what Juice Plus does is it creates more energy. It creates that, just that catalyst, that snowball to start other things happening. And all of a sudden you just make these other changes. And now Maggie's going to be in a like weightlifting competition, which is amazing. And her whole family has transformed. They go do CrossFit together. They all drink their shakes. They all take their Juice Plus, and they're all making healthier choices. It's really exciting. And then for people who want a program, this is Jules and her before and after. Her before is on the left, her after is on the right. And that was after 30 days of doing what's listed here. Some people like to do it for just 10 days, and that's called the 10-day shred. Some people do it for 30. It depends on whether you want to do that at all. We're not saying to do this unless you really want to, but some people want, that challenge to really just detox their body. And so not having the gluten, not having the dairy, those are the hardest things. And that is, to help your body not to have to process the gluten and the dairy, to break it down. And so we do 2 shakes a day, and we do the capsules, and then we eat really, really healthy. And we stop eating by 6, or I like to say 7. And then we drink lots of water and we get moving. And we have a new 10-day shred group starting up on the 18th. So get with the person who invited you. But basically, good nutrition equals good results. You're always going to get good results when you really attack the area of nutrition. So I just want to encourage you to do that. We have some one simple change ideas that are in our Facebook groups. Join us in those groups. We want you to feel like this every single day. And, these are really just 3 products that will bring significant change for you. I love starting people on the Orchard Garden Vineyard Blend and also on the Complete Shake. And I like to say, if you want more results, definitely, get more of those products and then do the shake twice a day. That's really how you're going to get so many more results. And it's a good investment. It's never been on the chopping block for our family because we would much rather invest in feeling good. There's nothing like going out to your car and it not working, right? Well, you don't want to go out to your body and it not work either. We want our bodies to give us the most punch for the day, right? And so that is how we're going to get it, is by having concentrated whole food nutrition. And Juice Plus is one easy way that you can do that. And so I just want to encourage you to get back with the person who invited you to this, to find out how you might be able to do that with your family. Do the buy an adult, get a child free, all that good stuff. And I'm going to, have anybody who wants to comment. I'm going to have you just unmute yourself. I don't want to unmute everybody, but you can unmute yourself and I'm going to stop the recording.